of the people who lived in the Ninth Ward did not have cars. Now, that's big in America, but 30% did not have cars. And so they were limited in their mobility, their flexibility, by the lack of transportation. Health and health care were major social determinants. Michael talked about his relationship with his physician, and I agree with him. It is empowering to have a medical home. And the likelihood of the people in this area having that kind of medical home was very, very low, because so many people were uninsured. And even if they were insured, most of the physicians who practiced did not practice in the areas where they live. And so they suffered. It's interesting that there were about 150 physicians in the Ninth Ward before the hurricane. And after it was all over, there were 20 left. Many of them had their offices completely destroyed, including friends of mine. And of course, many of them have suffered tremendously, including a lot of depression. But I think one of the very interesting things was the connectedness with family and friends. It's amazing how important it is for people to be connected. And what we saw with Hurricane Katrina was that some people were connected to family in Atlanta or Mobile. Those people were more likely to get out, to leave, to get to Atlanta, and even to have family and friends help them get started again. Some of them ended up a year later with much better jobs than they ever had in New Orleans. But the difference was this connectedness. Whereas there were a lot of people in the Ninth Ward who had no such connections. There was nowhere for them to go. And so many of them either waited to be taken out of New Orleans, which meant they were taken somewhere like Houston or places where they knew no one. So getting started again was very difficult. But the other thing, of course, is that there were people who didn't want to leave. There were people who died who wanted to die rather than to leave because they had nowhere to go. The only home they ever knew was right there in the Ninth Ward, and so they refused to leave. And of course, when people started searching for bodies, they found people in their homes who had never made any attempts to get out, especially older people. So this connectedness, they were connected all right, but they were connected to the only thing they knew and the only thing they had, their home in the Ninth Ward. I think those were major social determinants of what happened before the storm in terms of where people live, their attitudes toward life, and their commitment to this city of New Orleans, Louisiana. Now, I want to just spend a few minutes looking at some of the things that sort of reflect these differences. Let's just start with health outcomes. And now, this is the overall situation in the United States. There are major disparities in health by race, as you can see. Heart disease, death rates among persons less than 65, with the blacks having a much greater risk, American Indians having a fairly high risk, but major disparities. And those disparities start very early with infant mortality, where African Americans have about two and a half times the risk of dying in the first year of life as a majority baby. American Indians have almost twice the risk of dying in the first year of life. So even in the first year of life, we see major examples of these disparities. The bottom line, however, in an article in the Journal of Health Affairs in 2005, we tried to define this bottom line in an article we call What If We Were Equal? We looked at mortality ratios in the United States between African Americans and whites. The only two groups where we have data going back many years. In fact, we can go back to 1900 and tell you that in 1900, when the life expectancy in the United States was 47, it was 49 for whites and 34 for blacks. By the year 2000, when the life expectancy was 77, it was 79 for whites and 72 for blacks. We'd closed the gap from 15 years to 7 years, but still a tremendous gap in terms of just that one measure. But we looked at mortality ratios and asked the question, what if we had eliminated disparities in the last century? What would things have looked like in the year 2000? And it was really sort of striking because what we found was that there would have been 83,500 fewer deaths among African Americans if we had eliminated disparities. And those broke down, as you can see, in terms of heart disease and AIDS. But even in an area like the likelihood of having health insurance, the difference was so great that there would have been 2.5 million more blacks with health insurance, including 620,000 children. That was the article in the spring of 2005 in Health Affairs. But we were trying to get a baseline from which we could measure our efforts to eliminate disparities in health. Now, in Healthy People 2010, we tried to deal with the issue of determinants of health. And I must say that while that turned out to be very important, we certainly didn't have the awareness and sensitivity that I have today in terms of social determinants of health. But at least what we tried to say was that there are four major determinants of health, because a lot of people think of it primarily as access to health care. So access to quality health care was important. It accounted for about 15% in the variation of outcomes. Physical environment, 20 to 25%. Biology or genetics, about 20%. I should say physical and social environment. And then behavior, 40 to 50%. But it's that social environment that I think has gotten short shrift in all of our discussions, the social environment. There was a recent study by Felton Earls and his colleagues at Harvard about what happens to a child who witnesses a murder on the streets of Chicago before the age of 5, which happens all too often, by the way. And basically, after studying these children for several years, they found that children who witnessed a murder on the streets of Chicago were twice as likely to be victims of perpetrators of the exact same kind of deed within the next 10 years. Now, it raises a lot of questions as to how this social experience impacts upon the brain, for example, and in terms of what happens to children as they grow and develop. But there's more and more evidence that the social environment deserves much more attention than we have given it in the past. And I think hopefully the Commission's report will really jumpstart much more attention on that. And I think policies and intervention are important because it is here, of course, that we're going to make some major interventions in terms of looking at social determinants of health. We've got to change environments in terms of the way people interact and the way things play out. So there are going to have to be some major policy changes. After the storm, the Kaiser Family Foundation and others have tried to track what was happening to people. And as you can see, in the area of chronic health problems, displaced children, whether they're in Houston or Atlanta or other places, overall are more likely to suffer asthma, learning disabilities, behavioral problems. So the displaced population suffered from the social experience of being uprooted and displaced. In Houston especially, there were a lot of problems with violence in the schools, where these children were enrolled in school after leaving New Orleans. A lot of problems at first with violence, but also in New Orleans, a lot of issues with violence because of the way children just felt disconnected from their history. And I've heard a lot of discussion about that in this country, but this was a short-term experience of children being completely disconnected from their environment, their history. All of a sudden, their community was gone, their homes were gone. And we were very concerned about whether or not that was being adequately addressed. And the answer, of course, was that it was not being adequately addressed, and we're still struggling with that in terms of mental health. So every area of health care suffered by the displacement of people. One of the more interesting things, of course, was that because of the fact that so many people didn't have a medical home, and because of the fact that so many of the physicians had their offices destroyed, all of their records, it was very difficult to have any kind of continuity of care. Not only did many people not know what medications they were taking, they actually didn't know their diagnoses. And of course, the electronic health records would have solved that. The pharmaceutical industry, the pharmaceutical group that had electronic health records were able to help. But in general, we were talking about records that were washed away by the storm. Medicine has been very slow to take advantage